Hello, hello, hello. Welcome to the Medical Institute of South Georgia's Chapter 4 for Nurse Aid Training. And let's get started with Chapter 4, Body Systems and Related Conditions. A little bit longer chapter, but there is a lot of very important information inside of this chapter. And let's get started. All right, body systems and related conditions. And let's get started. Metabolism, the first term that I think you need to be familiar with, physical and chemical processes by which substances are broken down or transformed into energy or products for use by the body, our metabolism. Yes. A couple of signs that a nurse aide actually sees, hears, feels, and smells. Symptoms are directly seen by the nurse aide. That's a symptom. You can see it. You cannot see pain, so that's not a symptom. That's a sign. Symptoms are not directly seen by the nurse aide, but are reported by the resident who experiences them. Okay. These terms from smallest to largest. Organize these terms from smallest to largest. You got tissues, you got body systems, cells, and organs. So they got like a pre-quiz before we get into the content. We're going to actually skip right on over that. Dilate for eyes or anything that's being dilated, it means it gets wider. If it's constricting, it's getting smaller. Okay, dilate means get bigger, constrict means to get smaller. So the first system that we're going to look at is the integumentary system. Say it with me, integumentary system. And this is another term for skin. This is a picture of the skin and what is happening underneath the skin, under the tissues. The integumentary system shows one of the most obvious signs of aging in the human body. What is it? What other changes may occur? When caring for a resident, a nurse aide notices discolored areas on the resident's heels. Should this be reported? Absolutely. What should nurse aides observe for and report for the integumentary system? That's what you're going to be learning about in this chapter. Pressure injuries can be very dangerous to residents' health. So there is more information about pressure injuries in chapter 6 when we get there. You need to know that atrophy, when something atrophies, it gets smaller. Atrophy. Atrophy is the wasting away, decreasing in size, and weakening of muscles from lack of use. Contracture. It has to do with muscles and bones that are not being used, and they begin to pull inward. The permanent and often painful shortening of a muscle or tendon, usually due to lack of activity. You need to know the definition of both of those, atrophy and contracture. Here is a diagram of the musculoskeletal system. The musculoskeletal system is a combination of muscles and the skeletal. How does your musculoskeletal system change as a person ages? We want you to think about inflammation, which is simply swelling. I want you to know that an autoimmune illness, an illness in which the body's immune system attacks normal tissue in the body. Rheumatoid arthritis is a type of arthritis in which joints become inflamed, red, swollen, and very painful, resulting in restricted movement and possible deformities. That's rheumatoid arthritis. Osteoarthritis is a common type of arthritis that usually affects the hips, knees, fingers, thumbs, and spine, also called degenerative joint disease or degenerative arthritis. Make sure you know the difference. You want to watch for stomach irritation or heartburn caused by anti-inflammatory medications. Encourage activity. Adapt ADLs to allow independence. You want to choose clothing that's easy to put on and easy to fasten. Encourage use of handrails and safety bars. Treat each resident as an individual. Help maintain resident self-esteem by encouraging self-care. You need to know what osteoporosis is. It's a disease that causes bones to become porous and brittle, causing them to break easily. Menopause, as they say, the end of menstruation occurs when a woman has not had a menstrual period for more than 12 months. When we say partial weight bearing, the doctor may order partial weight bearing, stating that a person is able to support some body weight on one or both legs. Non-weight bearing means the doctor has placed an order stating that a person is unable to touch the floor or support any body weight on one or both legs. You need to understand what those definitions and abbreviations mean. Okay? You guys still with me? Let me see who I can see out there. I can see you. Non-weight bearing, again, is a doctor's order stating that a person is unable to touch the floor or support any body weight on one or both legs. Did we just cover that one? Yeah, we just covered that one. Full weight bearing means they can put weight on their legs, 100%. So let's go back here. Keep often used items within reach. Dress the affected side first. That's important. Put a star by that. Highlight it. Do not rush the resident. Ask for pain medication prior to moving them. Follow the care plan and have the resident sit to do tasks. You don't want to perform range of motion exercises on the hip replacement side. The hip cannot be bent or flexed more than 90 degrees. It cannot be turned inward or outward, okay? So to prevent that, you're going to use an abduction pillow, maybe used for 6 to 12 weeks after surgery during sleep. Transfer the resident carefully with the strong side leading. That's a test question. With the strong side leading when standing, pivoting, or sitting. With chair or toilet transfers, operative leg, knee should be straightened. Strong leg should stand first. You got that? Strong leg should be, yes, stand first. Now, some patients will have to have, especially after knee replacement, special stockings and or compression devices as ordered. You want to perform ankle pumps as ordered. Encourage fluids, especially fluids high in vitamin C, because that's going to help with healing of tissues. Assist with deep breathing exercises post-knee replacement. Ask for pain medication. Report to the nurse if you notice discoloration, swelling, heat, or deep tenderness in one or both calves. So it's your job to pay attention. Did you know that the nurse aide spends more time with the resident or patient than anyone else in the facility? And if you have a reputation of being attentive to your residents, the nurse is going to listen to you when you say, I'm not sure what it is, but something is going on with Miss Harris. She just don't seem like herself. They're going to get up and they're going to go check, because you have a reputation of being very attentive and understanding and knowing what's going on with your patients, okay? All right, let's look at the nervous system. The nervous system consists of the central nervous system and peripheral nervous system. Normal changes of aging to the nervous system include the following: slower responses and reflexes, decrease in sensitivity of nerve endings and skin, some memory loss, more often with short-term memory. They may have some. Now, my husband is going to be 77 in July, and he's sharper than I said. He's much, and I'm 21 years younger. He's much sharper, even right now, than I am in a lot of areas. He can remember who was the presidents back in the previous years, actual all kinds of details that I can't remember stuff from that last week instead of 20, 30, 40 years ago. So anyway, but some elderly do experience some memory loss. You need to know what hemiplegia is and hemiparesis. Hemiplegia, paralysis on one side of the body. Hemiparesis is weakness on one side of the body. You're going to see this on your state exam. Make sure you know that. Expressive aphasia, trouble communicating through your thoughts through speech or vomiting. Receptive aphasia, difficulty understanding spoken or written words. Okay. Emotional liability, inappropriate or unprovoked emotional responses, including laughing, crying, and anger. Dysphagia, difficulty swallowing. We definitely need to know that term. Difficulty swallowing. Dysphagia. In your book, there are going to be boxes that has guidelines for how you care for different kinds of patients. Make sure you read through those boxes. We're going to tell you how you take care of a patient after a stroke, how to take care of a patient who's having problems, who's having weakness, or who has cognitive disabilities. Make sure you read through all of those boxes. Now, here's some facts I just want to mention. For assisting with eating, place the food in the resident's field of vision so that they can actually see. Just because they got two eyes and both of them, it seems like they're looking, based on their condition, maybe they can't see out of the right eye. So you want to make sure you put it where they can see out of the left eye. Use assistive devices. Watch for signs of choking. Serve soft foods if swallowing is difficult. Always place food in an unaffected side of the mouth. Make sure food is swallowed. Gait is a manner of walking. Remember that term, gait and ambulate? Parkinson's disease is progressive, degenerative. This means it gets worse over time and it cannot be cured. We don't have a cure for Parkinson's disease. With people with Parkinson's, you want to protect residents from falls, help with ADLs as needed, assist with range of motion exercises, observe for any swallowing problems and report them to the nurse, encourage self-care and be patient. You definitely want to make sure you report any swallowing problems because they could aspirate on you and things can go left really, really quick. For people with multiple sclerosis, you want to assist with activities that they live in, be patient with self-care and movement, allow time for tasks and for them to move, give the resident time to communicate. You want to do everything you can to prevent falls, keep the area free of clutter, help avoid stressful situations, and listen to the residents. Symptoms of multiple sclerosis can change daily. Adapt the care to symptoms reported. So whatever is happening to the patient, you want to adapt the care to that. Encourage a healthy diet with plenty of fluids, give regular skin care, assist with range of motion exercises as needed. Paraplegia is a loss of function of lower body legs, and quadriplegia is a loss of function of legs, trunk, and arms, everything down low. With a head and spinal cord injury, you want to give emotional as well as physical support, prevent falls and burns, be patient with self-care, give careful skin care, assist with position changes at least every 2 hours, and you want to make sure that you perform range of motion exercises. That's going to be essential. Encourage fluids and proper diet, encourage fluids high in vitamin C, and that is to prevent UTIs. Give extra catheter care as needed. Encourage deep breathing, offer rest periods, provide for privacy, and assist with bowel and bladder training. Okay. Now let's talk about the eye, parts of the eye. You have your cornea, your pupil, iris, sclera, and retina. In your ear, at the very top, you have your outer ear area, you have your middle ear area, and your inner ear area. For your outer ear, you have your auricle or pinna, and then you have the eardrum. Is that part of the middle ear? I think the eardrum is part of the middle ear. And then the middle ear, The things that you see where the arrow is pointing, those are things that are considered part of the inner ear. I don't think you're going to have to label any of this. Your circulatory system. Circulatory is another term for blood flow. Has to do with the heart, and you see a diagram over here to the right of the heart structure. On the left-hand side, you see a picture of the human body and how the heart is situated inside of the human body. It's showing you a picture of the veins, pointing at the blue veins and the red arteries. Circulatory system problems are common. They can be very dangerous, and nurses need to be able to observe and report when there are problems that occur in our elderly. Hypertension is elevated blood pressure, okay? Regularly measuring 130 over 80, high blood pressure. You're starting to have, your blood pressure starting to be kind of high if it's 130 over 80. Write this down. Your best perfect blood pressure range is 120 over 80. And when we start practicing vital signs, you're going to see all about the blood pressure. The low acceptable blood pressure is 90 over 60. That's the low normal. The best in the middle is 120 over 80. And then on the other spectrum, the high normal is 140 over 90. You don't want it over 140 and you don't want the bottom over 90. But all of that is considered normal within those ranges. Diuretics are medications that reduce fluid volume in the body. Diuretic, like a water pill. So elderly patients might need more regular scheduled trips to the bathroom. Angina, you need to know what angina is. It is chest pain, pressure, or discomfort. Most of the times before a patient has an actual myocardial infarction or a heart attack, they will have what we call angina, which is regular chest pain, pressure, or discomfort in the chest area. So with a patient with angina or chest pain, you want to encourage rest, give them nitroglycerin, should be close by. Sometimes a physician actually prescribes nitroglycerin tablets for the person to put under their tongue in case they start to feel some chest pain. You want to tell the nurse if the nitroglycerin patch comes off. You can have a patch or you can put it right under your tongue like a peel and it dissolves. The resident may need to be told to avoid heavy meals, any overeating, and intense exercise, hot or cold, humid weather. Encourage them to stay inside and stay cool. Some other things to keep in mind with myocardial infarction, a cardiac rehabilitation program usually consists of a diet low in saturated fats and sodium, regular exercise program, medications to regulate the heart rate, and blood pressure to lower cholesterol and to lower triglycerides. And so the doctor should write you a prescription. Stay away from Carter's fried chicken because it is yummy, 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 and probably good to your tummy, but not good for your blood vessels. Regular blood testing, stop smoking because it causes your vessels to constrict, get smaller. Avoid cold temperatures, stress management program, and mental health care for anxiety. All of these things will help prevent myocardial infarction, which is a heart attack. Another one is congestive heart failure. Medications can help control congestive heart failure. So if a patient is calling, make sure you answer promptly, encourage residents to follow diet orders, allow for rest periods, measure intake and output of fluids as they are ordered, and then keep up with the patient's output. Weigh the resident as instructed. And when you're weighing residents, you want to make sure that you weigh them at the same time, pretty much weighing the same thing every time so that we can really see, are they gaining or are they losing? You want to apply anti-embolic stockings or TED hose, assist with range of motion, extra pillows for breathing, assist with personal care and ADLs as needed, and check with the nurse to see if high potassium foods can help with dizziness. Okay. We know what respiration and inspiration is. Expiration, we're familiar with that. Dyspnea, you need to know dyspnea, difficulty breathing. The respiratory system, let's look at what's a part of the respiratory system. You've got your pharynx, your larynx, your bronchus, which is down in your lungs. You have your trachea, which is the tube there, your bronchus and your lungs. And then at the very bottom, you have your bronchioles. Nurse A. Brianna is assigned to work with Miss Argowal. Yeah, we don't want to do that one. All right, let's go back to where we were. Hopefully we can pull it right back up. Let's go back. How we can put, no, here we go. Which one is this one? Yeah, there we go. All right, care guidelines for COPD. You want to observe and report symptoms getting worse. Help the resident sit upright. Let's make sure we're recording. Let's see. Are we recording? Yeah. Yeah, we're recording. I don't see the red button up. I'm checking to make sure we're recording. Yeah, we're recording. So you want to observe and report symptoms if they're getting worse. Have the residents sit upright. Remember with COPD, they're having difficulty breathing. These are people who have to sit over on the table to breathe. And at night, they may have to have 3 pillows to lay back because they can't lay down like regular people. Offer plenty of fluids and small, frequent meals. They can't eat heavy meals. Encourage a well-balanced diet to keep oxygen supply available as needed because they are going to have difficulty breathing, okay? Help them stay calm, and you want to be supportive. Use proper infection prevention practices. Good hand washing always helps. Encourage independence with ADLs. Remind the residents to avoid exposure to infection. Encourage pursed lip breathing. Okay? Encourage residents to save their energy. Encourage them to rest. With COPD patients, you want to report these signs. If they have a temperature over 101 degrees, you want to report that to the nurse. Changes in breathing patterns, changes in color or consistency of lung secretions. This is what they're spitting up. Changes in mental state or personality, refusal to take medications, excessive weight loss, increasing dependence. You should know that urinary incontinence means inability to control the bladder. The urinary system, we're going through a lot of systems. The urinary system consists of the kidney, the ureter, the urinary bladder, the urethra, and the meatus in both the male and female. Incontinence can irritate the skin and increase a resident's risk for pressure injuries. So nurse aides should do everything they can to prevent episodes of incontinence. You want to offer assistance with elimination, answer the call light when they call, document all episodes of incontinence carefully and accurately, wash the urine off immediately and completely, keep the residents clean, dry, and free from odor. Change their wet or soiled clothing, use disposable incontinence pads, encourage residents to drink plenty of fluids, and be reassuring and understanding in their situation. For urinary tract infections, you want to encourage residents to wipe front to back. This is so crucial and so vitally important. Give careful perennial care when changing incontinence briefs. Encourage plenty of fluids, as I've said many times on this slides. Offer to assist with elimination needs, taking showers rather than baths. Report cloudy, dark, or foul-smelling urine. Report if the resident has a fever. You need to know about digestion. Now, I think you do the process of preparing food physically and chemically so that it can be absorbed into the cells. Absorption is the transfer of nutrients from the intestines to the cells. That's absorption. Fecal incontinence, the inability to control the bowels. Gastrointestinal system, we're just running from system to system. Here are the areas that involve the gastrointestinal system. You see those here on the slide. I won't call all of them out. Just take a good look. All of these areas are included in the gastrointestinal system. So a person can have constipation, they may need an enema, a specific amount of water with or without an additive that is introduced into the colon to stimulate the elimination of stool. You should know the difference between constipation and fecal impaction. With constipation, the person's body is trying to eliminate the waste, but it's too thick and it's not able to travel through the anal sphincter. And then impaction occurs because the stools are too thick and can't travel through, so that they become impacted. A little fluid may pass around it and come out, but the stool itself just keeps piling on top of each other, piling on top. Now you have an impaction. And oftentimes it has to be, dug out. We gotta take the hook finger with 2 gloves, hook finger, and have the patient lie in the Sims position so we can help pull the stool that won't come out on its own. And oftentimes they may need a soap suds enema or some type of enema to loosen up that stool so that you can do the impaction. Impaction should not be done on your own because you could cause some real damage if the physician hasn't ordered this and you don't know what you're doing, okay? So be careful with that. Make sure you have an order to do an impaction. Ostomy, a surgically created opening from an area inside the body to the outside. A stoma, an artificial opening in the body. When a resident has an ostomy, her stool, her feces is eliminated through the ostomy rather than through the anus. And that's what we want you to know about that. A gland or organs that produce and secrete chemicals called hormones. A hormone is a chemical substance created by the body that control numerous body functions. Now, my favorite system is the endocrine system. Okay, so let me make sure I am recording. Close the share. Here. Okay, so it is recording. I don't see a light on though. Yeah. It will be recorded. All right, so let's go back. We're going to talk about the endocrine system, and we're almost done. All right, so how much do you know about the endocrine system? Here we go. Yeah, we are recording. Let's look at it together. You can get it to me. There we go. All right, so everything that you see here are the areas that are included in the endocrine system. The pituitary gland, the thyroid gland, parathyroids, thymus, pancreas, testes in the male, ovaries in the female, and the adrenals, which sit right on top of the kidneys. All of that is a part of the endocrine system. How does the endocrine system change as a person ages? So let's look at it. A person may develop diabetes, not necessarily because they're aging, because all elderly people do not develop diabetes, okay? Diabetes is a condition in which the pancreas produces too little insulin or does not properly use the insulin. Insulin is a hormone that converts glucose, another word for glucose is sugar, from the blood and into the cells for energy for the body, okay? You need to know those two. Glucose is just natural sugar. Prediabetes, a condition that occurs when a person's blood glucose levels are above normal but are not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is a type of diabetes that occurs or appears in pregnant women. So some guidelines for diabetes. As I mentioned earlier, make sure you read the boxes that are connected with each of the different systems. And that's going to give you the guidelines on how to care for the elderly based on that particular system. So you want to follow diet instructions exactly, encourage residents to follow the exercise program, and observe residents' management of insulin dosage. Perform urine and blood tests often, give foot care as needed, encourage comfortable shoes made of material that breathes, and socks made of natural fibers, so nothing irritates the skin. The reproductive system is all of the things that you see listed here. In the female, the fundus, the fallopian tube, the ovary, the uterus, and the vagina, as well as the cervix. In the male, you've got the bladder and the ureter, seminal vesicle, rectum, ejaculatory duct, prostate gland. All of the things you see listed here are a part of the reproductive system for the male. So what changes might you see? Residents have the right to sexual freedom, as we mentioned at the very beginning, and expression. So if they want to masturbate, it's their prerogative, like Bobby Brown says. So what are the functions of the immune and the lymphatic system? So now we've all moved on to some other areas. The lymphatic system, you see the lymph nodes with the little red dots there, and then the lymph vessels are the blue veins you see running through the body. And oftentimes with cancer, they may say the cancer cells have traveled into the lymph nodes or the lymph vessels, and that's how it metastasizes so fast or travels so fast because it got into the lymph system, okay? And you see what it looks like there. So how does the immune and lymphatic systems change as a person age? HIV attacks the body's immune system and damages and destroys cells. HIV virus is acquired through blood or body fluids. AIDS is the final stage of HIV infection. People with weakened immune systems due to HIV and AIDS may get opportunistic infections or diseases that a healthy person would be able to fight off. Even a common cold for a patient with HIV could kill them. Okay. Your book talks about the guidelines for HIV and AIDS. Make sure you read through that. Okay, the other thing is, Remember, AIDS causes a great deal of emotional stress. Nurse aides should be sure to provide emotional support and encouragement to residents with HIV or with AIDS. Tumor. You should know that a tumor is a cluster of abnormally growing cells. And oftentimes that's what you'll see with cancer patients. So remember this. Usually, cancer usually occurs in the form of a tumor that grows on or within the human body. Tumors are either benign or malignant. If it's benign, it's considered non-cancerous. If it's malignant, it's considered cancerous. They may often appear first in the breast or colon or rectum, uterus, prostate, lungs, or skin. They can spread to other areas of the body. There are different risk factors for cancer. Some, such as genetic factors, cannot be controlled, but there are some things that kind of causes it or it ignites it, like tobacco, alcohol use, or lifestyle choices. There may be some other risk factors that can also cause cancer as well. So treatments for cancer can be surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy. There's a lot of different types of therapy. You want to make sure as the nurse aide that you follow standard precautions. You treat everybody as if they are contagious. And so protect yourself from them and protect them from you, okay? And how do you do that? Wear your PPE as required. There are some guidelines for caring for patients with cancer, so make sure you review over that in your book. And guess what? For chapter 4, we are done, 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 done. Make sure you have completed your workbook. Listen, don't skip questions, even the ones that want you to fill in the blanks or the ones that want you to fill in content. They ask you a paragraph and they want you to go and list some information. Take the time to do that. I will be checking everyone's workbook for completion, and so you need to make sure you get that done. Okay? All right. We will meet again.